Hello, this is Dr. Michael Lee from Mobility Plus. Today we're going to go over some lumbar spine range of motions to find out what positions or motions seems to trigger your low back pain. First one we're going to start with, we call lumbar spine flexions. So you're going to put your feet together, put your hands on your thighs without bending your knees. You're trying to slide your hands down your thighs to touch your toes. Now, doing these motions, if you feel some stretching along your hamstring, that's fine. But if you feel anything from the low back or all the way shooting down to your heels or any of those tingling, that's not a good thing. Second one, we call lumbar spine extension. So we're gonna have our arms up. We're gonna look back and bend as far back as you can. Now it's normal that you're gonna feel some stretching in the front of your abs. Some of the things you may see is you may tilt over. Not the most ideal, but we see that a lot, and that's quite okay. But if you do feel any pinching in the back or anything again, shooting from the back down the legs, no. Now, the next two is called rotations. So you're gonna put your arms across your chest. We're gonna turn everything but your feet all the way toward the right. Now, doing this motion, if you feel some stretching on the left oblique side, that's quite normal. But if you feel some pinching on the right hand side as you turn right, make a note of that. Same thing, we're gonna turn all the way toward the left. Normal to feel some stretching on that right side, but not quite normal if you feel some pinching on that left side. Last two, we're gonna call lateral flexions or side bend. You're gonna put your hands right by the body, and you're gonna reach your right hand all the way down towards your toes. It's normal that you're gonna feel some stretching on the left side of the body, but you should not or don't want to feel any pinching on the right side of the low back. And we'll repeat the same thing for the left. Main point here is, if you feel anything in the low back, especially if doing any of those motions, you feel pain shooting down the leg, please go look for your nearest healthcare provider. Definitely want to take a look at this. In the follow-up video to this, we are going to show you some self-corrections on how to address some of this pain. Again, this is Dr. Michael Lee from Mobility Plus, here to help you to move better, to feel better.